Hello class, today we are covering breaking down coding cases for BC3020 Week 2. Week 2 covers medicine section coding, which includes a variety of services, including injections, ancillary services such as EKGs, and dialysis. Today we will be reviewing a case for hemodialysis for a patient with end-stage renal disease. What you will need is a copy of your Week 1 coding exam worksheet, your CPT manual, possibly a medical dictionary, and your ICD-10 manual. Let's get started. For case 1, dealing with the medicine section, we are given a disclaimer at the very top of the report of the case explaining what we need to code for this particular scenario on Week 2 coding exam. It's telling us that the patient is seen in the outpatient dialysis unit for the purpose of dialysis. Report only the monthly dialysis services of the physician for 4 or more visits during the month. So this is giving us a very distinctive clue that we will only be reporting pretty much one service. We have our location, which is outpatient hospital. We have the attending physician, and I've already highlighted this information to save time, but what I did in order to edit the particular exam is I just copied the case itself, not the full exam, the case itself to another Word document, and that allowed me to just highlight and edit and type on here anything that I need to assure that I'm abstracting correctly. So I would suggest you do the same as you work your cases. So once again, we have an attending physician, George Obitz, MD, and what he's doing is he has dictated his report from the dialysis service for today. So he's basically telling us that he's examining the patient during her hemodialysis. And then he's explaining that he reviewed the chart, giving us her vital signs. And then in a different scenario, all of this information may possibly be prevalent when we're dealing with evaluation and management coding, because we have the patient's history, her vital signs, and anything related to the physician services. But today, we're not going to even pay attention to any of that. What we're doing is reviewing the fact that she's just had dialysis. And then we're going to go down here to assessment and plan. The assessment and the plan. The assessment is pretty much after he's reviewed the case in the chart and examined the patient and her lab work, which is everything that's documented here. He is assessing what's going on with the patient, and then he's giving us a plan for her future treatments. So he's diagnosed her. An assessment and plan also includes your diagnosis, chronic renal failure, and end-stage renal disease. This could be considered her primary or principal or first listed diagnosis, simply because this diagnosis is the main reason for the services on today. The patient needs dialysis to cleanse her blood because her kidneys are not functioning properly, and in this scenario, if she did not receive multiple dialysis services a month, she could become toxic. So that's what renal failure is. So she's on a maintenance program, Tuesday, Thursday, and Saturday, for a total of 10 sessions this month. And so instead of him describing 4 sessions, he's saying 3 times a week, pretty much, for 4 weeks out of the month. And whatever month it is, seems like she'll have 9, but she's having 10 services. And her additional diagnosis is that status post right side nephrectomy, 7 years had a portion of her kidney removed, and that's a permanent diagnosis, history of or personal history of something. And then her additional diagnosis is left-sided renal artery stenosis. And as you know, renal is another medical term for kidneys. And so is nephro. So even though we have nephrectomy here and renal artery stenosis here, we're still dealing with situations related to the patient's kidneys or chronic renal failure. And then with the left-sided renal artery stenosis, he has included the fact that she has renal vascular hypertension. Sometimes these additional descriptions or subterms will make a difference in the code selection when you're doing diagnosis coding. So that's why it's important to pay attention to the full description of the code, and we will review that shortly. And then finally, the patient has diabetes. And it just has diabetes 2, so I'm assuming that means diabetes type 2. So he's just following up with his plan. This was his assessment. This is his plan. The patient is tolerating dialysis without any problems. We will give her Zentlar, 2.5 micrograms after dialysis. So that's pretty much it. We have our procedure outlined. Dialysis for 4 or more visits per month. You can search that. Then we have her diagnosis. We're going to first review what the procedure or the CPT is. So you need to have your CPT manual open to the alphabetic index in the back and follow with me as I review this particular service in the CPT manual. Okay, so in the alphabetic index in the CPT manual, I have located the word dialysis. That's my search term or my main term. As you can see, there are various types of dialysis services. So the one that closely matches the description of the wording in our case deals with this patient's diagnosis of end-stage renal disease. So this is the type of dialysis that the patient is having done. And this is in the medicine section. So what you want to do is take your code range, which is what I have here, and review it in the medicine section. And you can start with 90951 and review that description. As you can see, there are 2 other indented codes under 90951 when you get to that portion of the medicine section. However, we can see that this code, the 90951, has an age restriction. So when we reviewed our case, we saw that the patient was 57 years old. So 90951 does not match the services that were rendered simply because the patient is older than 2 years old. So now we have 90963, end-stage renal disease with related services for home dialysis for a full month. We look at the scenario again. We see that the patient is in an outpatient hospital. Additionally, this code describes services for patients younger than 2 years of age. So that code does not match the description of the services rendered. So let's review 90967. We have end-stage renal disease related services for dialysis for a full month of service per day for patients younger than 2 years of age. That does not match. But we do have 90970 for patients 20 years of age and older. So when you're dealing with CPT coding, you have the full description code as we see here, and then you have a semicolon. And if you've watched any of my previous videos, you will notice that the semicolon is a pause, and all the information behind it can be removed or transferred out for the other wording related to the coding or the descriptions of the codes underneath, which are the indented codes. Remember, you have your main code, okay, and as you can see, this code is the full code for end-stage renal disease, and as you can see, this one says comma, okay, and all of this wording behind the comma isn't included or should be considered a strong part of the code, which basically means that we cannot cancel out any of this information up here. The semicolon can be, I want to say, reused and added and removed like Lego blocks. So semicolon with 4 or more face-to-face visits. However, as you can see, the 2 years of age is still applicable to this code. The same thing with 90963. 90963 is for end-stage renal disease. It's a full standalone code, but it's also for home services per month. So that cannot be used, and it's also for children younger than 2 years old. So now we have a 90967, which is an indented code under 90963. However, we have 3 other indented codes underneath 90967, which is basically a full standalone description for the full month services. We can omit the patients under 2 years of age, and we can copy and paste. If I could copy and paste, I would copy and paste the description of this other code and use this instead, 90970. So pretty much this code is saying, 90970 is saying, end-stage renal disease related service for dialysis less than a full month of service for patients 20 years of age and older. And this particular procedure best matches what's been done on today. Now we're going to focus on the diagnosis portion of the services. You see that we have 3 diagnoses, so I'm going to take a minute and review the case again to make sure that we code this accurately. So my first diagnosis, or the reason for the services for today, is chronic renal failure, end-stage renal disease. Now, the first search term you could go to is failure, and then search down the list that way to kidney. Remember, the action word or the problem that is happening to that particular body system or organ system is your main search term. There are a few different ways to look things up dealing with diagnosis coding, but you always want to review your problem area or your problem word. Those problem words could be failure, disease, burn, accident, and anything action related, history, personal history. So think about that when you're reviewing your case to determine what your main term is and how you're going to find or locate your code. So what I did is I went to failure and went down to kidney, and then I was taking a roundabout way, so that's how I ended up in this area right here. But as you can see, I have kidney failure, I-129, and this is actually hypertensive. Let me go back. Anything related to eyes are hypertensive. And the only reason I'm choosing hypertensive is because my additional diagnosis states left-sided renal artery stenosis, renal vascular hypertension. So it's hypertensive chronic kidney disease is the best way to code this service or begin coding this service. Okay. So we have I-29. And then we're also seeing additional indentions underneath, as we can see stage 5 chronic kidney disease or end-stage renal disease, and it's giving us I-12. So when I look in the tabular list, I am seeing the hypertensive chronic kidney disease. It's telling us what it includes: any condition in the N18 and N26 due to hypertension, arteriosclerosis of kidney, arteriosclerotic nephritis, chronic interstitial hypertensive nephropathy, and nephrosclerosis. So, diagnosis B says left-sided renal artery stenosis. Stenosis is also another term for sclerosis that can be used interchangeably. So we want to pay attention to include the correct diagnosis for that. And then we have it excludes hypertension due to kidney disease. We're not coding that, so that's fine. Renal vascular hypertension. And secondary hypertension. So I'm seeing renal vascular hypertension, which is probably a better code, I-15.0 and I-15.1. So as you can see, I started with the kidney disease, or the kidney failure, or hypertensive kidney failure, and I had to make sure that my inclusion notes and exclusion notes did not exclude what we're looking for. So the provider did mention that the patient had left-sided renal artery stenosis with renal vascular hypertension. So I'm seeing here renal vascular hypertension is I-50, and that is not included in the I-12. So we cannot code the I-12. I'm going to go to I-50, and I am going to review what it states here. It says hypertensive chronic kidney disease with stage 5 chronic kidney disease or end-stage renal disease. And then as we can see, we're moving all the way down to secondary hypertension, which is renal vascular hypertension. So the best code, one of my best codes, is I-15.0. I'm going to keep that. And then as you can see, as we're searching for the kidney disease or chronic kidney disease and kidney failure, we are given parenthetical notes that tells us use additional code to identify the stage. So this code only identifies the secondary problem. We still need to code the main problem that the patient has, which is chronic kidney disease or kidney failure, and chronic kidney disease or end stage, which is stage 5. And as you can see here, we have another excludes notes. Chronic kidney disease, it excludes chronic kidney disease, stage 5, requiring chronic dialysis. This patient requires chronic dialysis, so we need to move down to the N18.6. So as you can see, we're given ranges of codes to research, but the best method is to always review your excludes notes and your parenthetical notes to make sure that you code accurately. Now we have N18.6, which is end-stage renal disease, chronic kidney disease requiring chronic dialysis. We have another note here, okay? Code to identify dialysis status. So first we're going to pull this code, N18.6, and this is going to be my primary code or my first listed code because this is the main problem that the patient has. I have a note that tells me to use additional code to identify dialysis. However, I'm seeing the 3-digit category here, which just the main category associated with chronic kidney disease, explaining that I need to code first any associated diabetic chronic kidney disease and hypertensive chronic kidney disease. Now it just tells me that the patient has diabetes 2. It does not say that the patient has diabetic chronic kidney disease. However, we have to check the code and look at the rules and guidelines to assure that we are coding accurately. So the provider says that chronic renal failure, end-stage renal disease, is secondary to the following. Secondary meaning that this particular condition, renal failure or kidney failure, is a manifestation of a disease progression. So the disease progression began with diabetes. Then from there, the renal artery began to constrict, resulting in renal vascular hypertension. And then the patient ended up having right-sided nephrectomy, a portion of or all of her right side of her kidney removed. And then from there, the disease progressed into end-stage renal disease. So what we want to do is use diabetes mellitus due to underlying condition with diabetic chronic kidney disease E08.22. And this code says diabetes mellitus due to underlying condition with other diabetic kidney complication. This says other kidney complication. We want to use the code that specifies chronic kidney disease. So we have E08.22. And I'm actually coding all of my diagnoses because they're all leading me from one to the other. Okay, so now I want to review the instructional notes on this. And that's just proper coding, just making sure that I cross all of my T's and dot all of my I's. And this is the endocrine system. Code first, the underlying condition. Alright. Use additional code to specify insulin usage. Now, I have to go back and verify if the patient is actually taking insulin. The one thing dealing with diabetes is that with ICD-10, you would need to use an additional code to specify if the patient is on long-term insulin usage. Okay, long-term current use of insulin, Z79.4. I'm just going to jot that code down, and I'm going to review the case to determine if the patient is taking insulin. So that's a little tip for you. You always want to review the guidelines to make sure that you code everything associated with a disease or disease progression. So I'm going to go back to the 918.6 and finish up there, because this code has given me instructions to specify dialysis status. So we have Z99.2 says that the patient is dependent on renal dialysis. It includes hemodialysis, peritoneal dialysis, renal dialysis status not otherwise specified. So yes, this patient is dependent on dialysis. So we have Z99.2 as well. So as of now, I have code N18.6, I15.0, E08.22, and Z99.2. I need to verify. I'm going to go back and look at the case, so bear with me for a minute. I'm just going to see if I can find the word insulin. does not say that the patient is taking insulin. Then he did say the patient, he will give her Zemplar. And if you don't know what Zemplar is and if whether or not it's insulin, you can always Google the medications to determine if you're overlooking an insulin related. That's what I'm doing now, so bear with me. Okay, Zemplar. Nope, that is not insulin. So therefore, the patient is not on long-term use of insulin, so we do not need the code, or they didn't mention it. She could be, but it's not documented, so it didn't happen. So therefore, we do not need to code the Z79.4. So we should have 4 diagnosis codes for today. Now you want to review your case and abstract the same way that I did. Make sure you review the guidelines and all the notes associated with the coding rules, just like I did. Look at the little notes. Code this, excludes this, includes this. And if you do that every time you do coding, especially ICD-10, you should be able to code every diagnosis accurately. So just go back to your case, highlight the information, review the chart in the same manner that I did, and do that for every single case that you work this week, and you should do well. Thank you for watching. Have a great day. Bye-bye.